Okay, good morning. I think we might as well get started. I hate to punish people who are on time by waiting for folks to join us a little later. So let's get started. You have already heard from, and I'm sure met Sarah St. Laurent, the COC coordinator for Rhode Island Continuum of Care and Rhode Island Housing. I'm Howard Birchman with Housing Innovations. We're privileged to be able to work with you on the NOFO process and some other things. I'm joined by my colleague, Sarah Zudovine, who we will be presenting to you today. Just the preliminary stuff, as you all know, please, if you can, keep your microphone muted unless you want to ask a question, in which case, feel free to unmute at any time and ask your question. We certainly will have time at the end of the session for questions, but if something is happening beforehand or something confuses you, or I said something that just makes no sense whatsoever, please feel free to jump in and say, what? And we'll address your question then. Also, if you're comfortable, I know some folks have got their cameras on. That's great. It's lovely to see some reactions to people. But if you are not in the camera mood, that is fine too. Feel free to go along and as the way you are. So, good morning. Pleasure to be here. We're going to talk this morning about what we know and what we understand to be the case for the 2026 competition for COC funds. Specifically, we're going to be requesting and giving you information about submitting new project proposals, and we'll talk about the process that we use here in Rhode Island for submitting those new project applications and then ultimately submitting the final application to HUD, and then ultimately, hopefully, getting awarded funding and proceeding on with the project. So, first off, let's talk a little bit about where we stand time frame wise. Um, so we started the competition last week, our internal competition here. Obviously, these are the two information sessions we're having. Important date for you all is this date of June the 12th. That is when we are hoping to get these basically expressions of interest, these preliminary applications in. I want to tell you, we're going to describe the process of this application process, but I also want to say, based on a session we had with Sarah earlier this morning, we're also going to early next week basically take this information that we present in terms of what we want from you and complete sort of a single application form that'll have all the information in it in one single thing to hopefully make your application process a little easier. So contemplate what your application is going to be, and as early as possible next week, we'll have a detailed form available for you to complete and submit by that June 12th deadline. We expect basically what's going to happen is these applications are going to be reviewed. There are going to be some threshold factors. If an application doesn't meet those threshold factors, it won't be reviewed further. We'll describe in detail what those threshold factors are. And then after that, each individual application will be reviewed and scored. Those that score the highest will be recommended by the COC board to continue and submit an application directly to HUD. A lot of this is predicated on the belief that HUD in the very near future is actually going to start the competition for the 2026 funds. HUD has forecasted, has publicly announced that it is their intention to issue that notification of funding opportunity by no later than Friday of next week, or what, 9 or 10 days, 9 days, I guess, from today. We shall see. That's what they say is going to happen. Then assuming that that is the schedule, basically after in early July, we notify folks that they have been selected to proceed. We would hope that by the end of July, and if HUD is moving according to their schedule, they will have opened up their online application portal, the eSNAPS system, and therefore we would expect folks to have their grants submitted into eSNAPS by the end of July. This is all based on HUD's published deadline for the whole competition being August the 26th. Now, it is entirely possible those dates may change, but those are the dates that HUD has given us, and we are going to be doing our schedule and acting as if those will be the actual dates. We would have to wait too long. If we see the NOFO by next Friday, then we'll know they're going to meet the schedule. If Friday comes and goes, then we'll probably, and we haven't seen the NOFO, and it's Memorial Day weekend, we may be looking at a different schedule, slightly different schedule than the one we're talking about now, but we need HUD to confirm one way or another. Assuming that the end of the final deadline that HUD has said is going to be the final deadline is at the end of August. We would hope to have all our applications in and the COC application itself completed by mid-August, ready for it to be publicly posted, be able to get comment on it, and submitted to HUD well in advance of the final deadline. Obviously, we have to meet that deadline requirement. So this is the time frame that we are looking at today. Um, Among the things that we are expecting from this competition, some very, very significant changes. I know a lot of people have heard about this already, but it's without doubt that HUD is going to allow a different kinds of new project applications than they have allowed in recent competitions. I mean, for decades at this point in time. So HUD has made it very clear they are emphasizing the transitional housing model, and transitional housing is definitely going to be an eligible activity for or an eligible project type for new projects. They're also emphasizing supportive services only projects. We'll talk about all of these a little more, but these are project types for either supportive services only for street outreach or for enhanced supportive services for other projects. Those are new project types that had not been allowed as new project types before. I know folks have heard about the fact that HUD is talking about basically limiting renewals of current permanent housing to be no more than 30% of the total annual renewal amount that we have in the COC. That has been a pretty consistent message from HUD, so we expect that something like that is probably going to be the case. The COC coordination team has been working with grantees, talking to those who are probably not, again, overwhelmingly, our inventory is permanent housing, so capping our renewals at 30% is going to have a very, very significant impact. There are a number of well-performing permanent housing projects that are not going to be able to be renewed, not because of anything that they've done, but just because of this complete drastic change in policy on the part of HUD. So that will occasion a lot more new applications as we seek to replace the permanent housing ones that we can't renew. Additionally, HUD is making the competition far more competitive than it has been almost forever. HUD initially wanted to limit remember, tier one are those projects that are essentially guaranteed funding in the competition. HUD initially wanted to set that at a very low level. Congress mandated that HUD set that tier one level no lower than 60% of the annual renewal amount. So basically, we can be more or less assured that we'll retain at least 60% of our funding, but at the same time, about 40% or a very significant portion of our funding is subject to the competition and potentially at risk of not being funded in the competition. Additionally, when HUD issued their NOFO, or when HUD released their NOFO for 2025, they said they're releasing it for basically informative purposes. It was blocked by a court order from a lovely district court in the lovely state of Rhode Island, from proceeding with their competition. HUD released the NOFO basically for informational purposes. And in there, they had a set aside of, again, 30% of the annual renewal amount for new permanent housing. I know it sounds a bit crazy, but basically, the way they had structured the most recent NOFO, they were going to limit permanent housing renewal to 30% of annual renewal demand, but at the same time, allow you to apply for new permanent housing up to 30% of the annual renewal amount as well. Um, I know folks have heard about this as well. We know that basically HUD has been using the Housing First model as basically the organizing principle for their homeless assistance for quite a period of time. Right now, well, they're over that. At least this administration is, and they basically are standing it on its head. And instead of having a voluntary participation in services, they're basically insisting that service participation be mandatory for all COC funded projects. They've got various ways in which to make that work, but basically they're setting up the point structure both in order to get new projects funded and in order for the COC to score maximum points and get any new projects funded are all going to be predicated on the COC adopting a policy of requiring participation in services. Again, never within our COC is the goal going to be we're going to use this requirement in order to terminate, exclude people, throw them out of the programs. Our goal is to comply with this requirement and basically find ways to work with participants to do everything we can to keep them enrolled in the program, give them multiple opportunities to come into compliance, and only in the most extreme cases are we going to try and terminate folks for service participation. But obviously, in some instances, that may potentially be the case. There's a lot of discussion that one of HUD's intentions here is to sort of redistribute continuum of care funding from a lot of the folks that have got a lot of funding today to other COCs that don't have as much funding. One of the ways in which they're going to do that is by allowing applicants to apply for significantly larger amounts of bonus funding. In the 2025 one they issued, you could ask for 20% of your annual renewal amount as a bonus. In the past, that had been more like 10% or so. So the potential bonus thing is much larger, but that's also increasing the risk, increasing the possibility that some funds will be taken away from some COCs and given to other ones. And in the past, the youth homelessness demonstration project grants had been renewed rather non-competitively, meaning if you had a YHTP grant, as long as you submitted an application to HUD, HUD would work with you to correct any errors in the application. HUD sort of committed to funding all YHTP applications that were submitted to them. Now, youth homelessness demonstration projects will be competitive or ranked along with the other projects, and it's possible that some of them, based on their ranking, might not be renewed in the competition. Um, yeah. Okay. So again, just to be clear here in terms of who should be responding to this RFP that we have issued from the continuum of care, basically any organization that's eligible to apply for funds, that is a nonprofit organization, it's a unit of local government, it's a public housing authority, any of those entities can apply for a new project under these components of transitional supportive services only or permanent housing. And any organization that currently has a permanent housing grant that is not going to be able to be renewed because of the 30% cap on permanent housing funding, all of those grants must respond to this thing with a new project application, or else, we cannot renew that existing permanent housing project. So unless those organizations with permanent housing projects that can't be funded under the cap, unless they apply under this competition, they're not going to be able to continue having COC funding. So basically, any eligible organization is welcome to apply. Anybody who's got permanent housing funding that can't be renewed really has to apply in this competition if they want to continue to be part of the COC funding. Now, everything many of the things that we're going to say here are subject to change. HUD has not issued the NOFO for 2026 until such time as they do issue it. We don't know exactly what the requirements are going to be. We're not going to know exactly what they're going to allow. And it's possible that things that they said definitively in 2025 will change when they get to the 2026 thing. We just don't know. So be aware when the NOFO does come out, which could be next week. This is subject to change. Obviously, if there are changes, if anything that we have said has been basically contradicted by information that comes out of HUD, we will notify you ASAP so as to be able to make corrections. We're just trying to, since it's possible this process is going to go ahead and there are major changes, we want to give you as much advance time as possible in the development of applications so we can get solid applications submitted to HUD. So I guess that's all I can say. This is what they said are going to happen. It's entirely possible that something else will happen. Also, about the thing I haven't mentioned about the HUD deadlines, there's some things that HUD has always in the past needed to do before they could start a COC competition. The most important thing they have to do is award all of the grants that are going to be renewed in this competition. This has never happened before. This is already late May, and HUD still has not awarded the grants that are expiring, in the second half of this year, 2026. That's never happened before. So HUD has to award those grants. They have to then develop a complete grant inventory worksheet that lists every grant that is in our continuum of care that is eligible to be renewed in this competition or reallocated. That has not happened either. They've never had a competition without first issuing a grant inventory worksheet. It's a new world. It's a new administration. They may do things differently than has ever been done before, or they may realize that they've got to get this grant inventory worksheet issued for them to be able to go on with the competition. And it may be the competition will be delayed a certain amount of time for them to go through that process. Who knows? They haven't awarded the grants yet. They haven't announced the awards of those grants yet. Congress has not required them to do that before the 1st of July. So we shall see how things unfold. Obviously, as I said, make sure, HUD has those listservs. that will
Hello.
give you announcements about the competition. Pay attention to that, but in case anybody misses those, we'll be sure on the COC side to keep you informed as things unfold here, because these
33 Pleasant.
things could really change. Please mute yourself if you are not saying anything here. Um, we've got all kinds of information, both the slides that we're going to be present or are presenting today will be on this website. The recordings are going to be on this website. In the near future, we're going to have a series of frequently asked questions, which are going to address the questions that come up in these sessions and also that folks also call in over the next period of time. We're going to also publish some guides, some new informational things. So we'll notify you when new things are being posted on the website, but we're hoping that website will be a very rich and valuable resource. Sarah is your key point of contact if you've got any questions about the process. She is the coordinator. She is going to be running the show here. So feel free to reach out for assistance. We're all here to help to make sure that this works as well as it can for all of you. Okay, now the process that we're doing this year is basically, although HUD is changing a lot of the stuff, the process here in Rhode Island is the same that it has been in years in the past. We've always done this sort of preliminary application process that starting out right now. On the basis of this preliminary application process, we'll then identify those applicants that are going to go forward and formally submit the application in eSnaps to HUD. Remember, just being selected through this initial process does not get you a HUD grant. You have to then submit your formal application to HUD through their eSnaps application portal, and HUD has got to review those applications and award funding. Only then will you know for sure that you're going to get COC funding for your project. We're going to make sure we'll do our own threshold review to make sure that we're not submitting any projects to HUD that will not pass their threshold review. And we'll do our best to make sure that everybody has as many of their project quality points as possible to increase our likelihood of funding. Um, and again, as I said, any organization that's eligible to apply is extremely welcome. It's nonprofits, it's organizations of local government, and it is public housing agencies. Remember, anyone applying would be expected to have some experience, both in terms of serving the population that they're identifying to serve and providing the services that they're talking about serving. And on top of that, have the appropriate infrastructure in place to be able to manage and administer federal funding. There are going to be new project opportunities. Indeed, we're asking for folks to submit new project applications. We believe that there is going to be an opportunity to submit new permanent housing applications. We expect that when HUD does open up this competition, they're going to give us some guidance, some frequently asked questions. Obviously, the question comes up, if we cannot renew a permanent housing project, can that applicant then go in and submit a new application for new permanent housing that closely resembles what we are not able to renew? We haven't seen any guidance from HUD that says whether you can or cannot do that, but certainly we will advise you as to when they can. HUD has said that they expect all their permanent housing to be more tightly targeted. Permanent supportive housing would be targeted towards either the elderly, those who are 62 years of age or older, or those people with disabilities and are unable to work. Similarly speaking, it appears as if new rapid rehousing projects, if HUD allows those, they will also be limited to people with disabilities, which is a change from what the policy had been on rapid rehousing. It is HUD in some of their earlier NOFO efforts were seeking to restrict the population of people with disabilities that could be eligible, trying to limit it towards people with physical or developmental disabilities. Um, we shall see when the NOFO comes out. I know there had been some legal challenges around restricting based on disability status, so we shall see how that unfolds when the NOFO is ultimately issued. HUD, by the way, those of you who are following carefully, there had been a time when HUD had established, they called it orders of priority, basically saying, your COC project should support basically the chronically homeless and then this dedicated plus population. HUD, with little fanfare, totally rescinded their directives in terms of the order of priority for COC assistance. So as things now stand, HUD does not have that recommended or suggested order of priorities. However, HUD has not said that COCs are required to change their order of priorities. It has not said that COCs cannot continue to prioritize those who are had the longest time homelessness, have the most severe service needs, the chronically homeless or dedicated plus population. So as things now stand, and until HUD has issued policy otherwise, the COC policy remains, and the COC will remain structure, targeting permanent supportive housing projects for those who have got the greatest need for those services. So that's probably going to remain in effect as we go forward. As I said, for the
Howard,
first time, yes.
there's a question. Um, is there a potential that being on SSI, SSDI could be an eligibility requirement for PSH going forward?
Well, disability is certainly going to be a requirement. SSI and SSDI is certainly, that means Social Security is determined that you're disabled. But again, that is not the only definition of disability there. There's always been being qualified as disability by Social Security has always qualified you for HUD, but it has never been limited to being considered disabled by Social Security. So we haven't seen anything that says that it'll be that requirement, but we certainly have seen stuff that you're going to have to otherwise document the disability. I hope that helps. Transitional housing, as I said, is this new type. Well, it's not new, it's an old model that's been around, but it's one that HUD is encouraging strongly in this competition and will make available for it. Again, like rapid rehousing, the length of assistance is limited. You can serve, again, basically all folks who are experiencing homelessness. Those are literally homeless. Those are at imminent risk of homelessness. Those are DV survivors. Um, Under transitional housing, HUD expects a very robust services package. Their last NOFO was suggesting that that services package would look like 40 hours of services a week. That's not 40 hours of case management, of course. I mean, there would be expected to be a significant case management thing, but there would be a lot of other activities. Self-help 12-step meetings would count as part of that service requirement. Any volunteer activity that folks are doing, if there are any kind of peer groups or something like that in the program, all of that would count towards it. There are various ways of meeting those requirements. It's not the expectation that your program will be fully funded to provide 40 hours of services to each participant, but it is expected that your program would have a larger services budget than would in the earlier model. At the very least, you'd have robust enough staffing to be able to coordinate that high level of services that are expected for people. And one of the big emphases and goals for HUD in the transitional housing program is that folks will end up with employment income as a result of participating in the program. There are going to be, in addition to those three housing types, there are going to be several models of supportive services only that are going to be eligible for new project applications. Coordinated entry had always been an eligible program type for new project applications. Remember, a coordinated entry project would be limited to those entities in Rhode Island that have been designated to provide coordinated entry services. But the other supportive services only project types, either street outreach or enhanced services, are available to any eligible organization in the COC. Obviously, the street outreach is targeted towards people who are living unsheltered, and HUD expects coordination with first responders and law enforcement. And then enhanced services is basically, again, the NOFO is really emphasizing services. There actually are points in the NOFO for the COC score based on the percentage of the funding that we're asking for that is dedicated towards services. So HUD has kind of changed their tune on this. They're very open and welcome to applications for services. And one of the ways in which we may be able to meet these increased services requirement is providing enhanced services through SSO grants. So consider making an application under that category if that makes sense for your organization. Um,
Sorry, Howard, there's a question about is there any specifics on what HUD means by medically supervised as it applies to transitional housing? I think we've just been hearing that as a statement from that Stephen Marbett in those informal meetings. So
Philip,
that's hmm?
Philip Marbett.
Oh, Philip, sorry. Um, th- he's just throwing it out there, and so that sentence is all we've got, but we hope that there'll be a more elaboration on that when they actually release the document. And then any additional context on what coordinating with law enforcement means in practice? Not that I know of, but certainly there are ways that which all of the COCs coordinate when you really look at it, how much you coordinate with street outreach and um, we just are assuming it's going to be really showing that the COC coordinates in positive ways on working together on encampments or outreach and other areas that I'm sure we'll be able to elaborate on.
Great. Thank you for that. There also is going to be, as you know, there has always been the regular COC bonus, which will be available for new projects. There also will be likely expected to be a DV bonus project. Um, Basically, HUD, they used to be the allowable program types. They used to allow the joint transitional housing, rapid rehousing, but HUD has announced that it will not accept any new applications under that so-called joint component. So the allowable project types for the DV bonus are either going to be rapid rehousing or transitional housing. The potential is also for coordinated entry, but there's not likely a need. We have significant funding already in Rhode Island for coordinated entry for DV survivors. So that is not a big need, but basically we're certainly open to any possible projects that are submitted as either rapid rehousing or transitional housing serving DV survivors only. Um, the requirements for the DV projects are pretty much the same as they had been. The only significant one is, like all these projects, DV bonus projects are expected to mandate service participation by participants, but otherwise the requirement that they be trauma informed and victim centered and involve survivors with lived experience have all been consistent requirements in the past for DV bonus projects. HUD has made it very clear that any project funded under the DV bonus category is going to have to serve survivors only, both in that project, and if those funds are ever reallocated by the COC, they can only be reallocated towards another project that is serving survivors. Those funds cannot serve other populations. As I said, there's possibility to have funds for coordinated entry or HMIS expansion, but the only eligible applicants for those pots of money are going to be either the HMIS lead or the coordinated entry designated lead agencies. Process for going through this application process, as I said, is the same as it's been in the past. By the 12th of June, we hope folks will submit these preliminary applications to the COC planning team. As I indicated, and I'll go through the factors, but there will be a threshold review of those factors. Every project passing threshold will then go to a scoring committee who will review and then score the project applications. The highest scoring projects will be recommended to the COC board, the ones that the board adopts. Also, those who've been through this process before, the amount of money that you request in your application is really important, but there is a high likelihood that the board will come back and request some modifications in the budget. You should ask for every dollar that you think is important for the project, but then it's got to be looked at in the context of all the funds that are available. It's highly likely that you may get a suggestion coming back that we're going to fund the project, but we need you to adjust the budget to X, Y, or Z dollars to fit within the overall funding available to the COC. So remember that. Then any project that's recommended and goes forward must submit their individual project application, as I said, within the HUD application portal, eSNAPs. Those will all be ranked. We have The process had always been in the past that we'd rank the renewals first and then the new projects. This year, they're going to be, since the renewals are limited by HUD, there'll be many more new projects. And so new projects will end up being ranked in tier one, as well as renewal projects, just because of the way the competition is going to work this year. Of course, just because the board has accepted this preliminary application and forwarded the application to HUD does not mean that HUD is ultimately going to fund it. You're only going to get the funds if HUD indicates in their notification of awards that your grant had been funded by them. Okay, I think we want to spend a little time talking about some of these new models, and we'll have some more information, which we'll post more detailed graphic information about the transitional housing model. But basically, briefly overview, again, as we've said, assistance should not extend longer than 24 months. By the way, I mean, if you've had a resident and transitional housing project and is now, 24 month and 1 week, If you do not have other appropriate housing for the household at that point in time, you're not supposed to terminate them. You want to continue working with them until you can find appropriate permanent housing for them. The way the HUD regulations read on transitional housing is if more than 50% of the program participants have been in transitional housing for longer than 24 months, HUD may take action against the grantee, but that gives you a lot of, it says over half of your participants being in transitional housing for more than 24 months. So obviously, if you have, one or two participants going for a longer period of time, you're going to be fine. But again, the goal is for this not to be permanent housing, but for folks to move on to other housing. They are very keen on these 40 hours of structured services, some of which should have this clinical supervision. Again, we've had pretty good success coordinating with Medicaid resources and things like that. In theory, if folks are doing any kind of supervised substance use treatment, behavioral health services, and things like that, the likelihood is good that we can find some connection to some clinical supervision for those programs as well, especially if we have on staff any licensed social workers engaged in providing those services. HUD's goal for transitional housing is that at least half the participants are going to have employment income. So obviously employment is a huge focus. Obviously, as many possible are going to be moved from transitional to permanent housing, and very few people in transitional housing will then return into homelessness. And you can either do this at a single site setting, which is often the model for transitional housing, but you can also develop it on a scatter site basis by renting scattered apartments in the community and providing services elsewhere.
Howard, we have two questions on here.
Mhm.
Um, do we know if those working part-time will still have a service requirement? I would guess that they're going to be sticklers to the 35 or 40 hours, right?
Yeah, but it'll be reduced by the number. I mean, so if
Mhm.
somebody's working 20 hours, then I would assume that their service requirement will be reduced by at least 20 hours. So they say they're going to modify that requirement based for folks who are working, since the goal is to get people working.
And then if they're disabled, do they still need 40 hours of work a week of structured services? That is for people, boy, if they're disabled. I guess it
Yeah.
depends.
Again, it'll be adjusted. There will be a service participation requirement, but it is unlikely that it'll be that structured as structured or as demanding as the full 40 hours for people who are not employed or non-disabled.
And then is that employment income requirement any income or enough income to sustain housing after the program participation ends?
So ideally, it's the latter. I mean, because we want people to be able to afford their housing, but to really meet the requirement here is we just want to be able to report in the annual performance report that our participants have earned income. Basically, it's the presence of earned income that counts, not the total amount or whether that earned income is sufficient to live independently. Was that those were it?
Yep.
Okay, we'll keep going. Again, the goals are, of course, to transition to independent living, increase their employment. Basically, when the transitional housing model appears to have worked, it's really when it's applied towards people who are in some form of a life transition, which could be obviously youth and young adults, are by definition in transition to an adult stage. People in recovery are clearly in a transitional stage while they strengthen and enhance their recovery. Folks who are fleeing domestic violence are often in a transitional stage in life. There could be a respite model or something like that where people have got serious medical conditions and they need a safe, secure, supportive environment in which to fully recover from that medical condition. Could be appropriate folks for transitional housing as well. And then finally, as long as you can establish that the folks meet the homeless definition, people are leaving institutions either long-term hospitalization, people who are incarcerated, often need some structured support to be able to adjust to independent living, and they might be appropriate candidates for transitional housing as well. Um, when you're considering the projects to submit, there are three different avenues that you can go. You can either submit what I'd call a standalone new project. Basically, it is a project from any eligible organization that's seeking either new permanent, new transitional housing, a new supportive services only. There's no linkage between that project and any existing COC grant. The other opportunity is you've got an existing COC grant, but you want to offer enhanced services to the participants, or you want to increase the size of the project to provide additional beds, additional units of services. Those would all be considered an expansion project. To do an expansion project, you have to have a renewal of an existing COC project, and then you're going to submit a new project application that basically is just enhancing, expanding, providing more funding for that existing renewal project. And then finally, the other model that we want to talk about is the transition model. In the transition model, again, you've got an existing COC grant, but that grant is not going to be renewed. It could be because it's not underneath that 30% permanent housing cap, and so therefore it can't be renewed. And so therefore, you're going to use the transition model to basically, you're going to start the program as the transition approach starts as soon as your grant ends. You start the transition, you've got 12 months in which you go from your existing, say it's a rapid rehousing project, to convert that rapid rehousing project into a transitional housing project, if that's what your transition is going to do. So you complete the current grant, then you start up a new grant. You can start it as a transitional housing project, but over the course of 12 months, it will fully convert into a rapid rehousing project. We've got more slides and information on those two types. And now I'm going to turn it over to Sarah, who's going to walk you through a little more detail on the expansion process.
Sure. So expansion applications, the renewal can submit an expansion application you can either provide more units of housing, additional services to the current participants, or bring those existing facilities up to government health or safety standards. Those are the reasons that you can apply for an expansion. Next slide. Transition projects. They have to be submitted by a current recipient, and that renewal project must be fully eliminated through reallocation. Can't be partial. This will start at the end of your fiscal year 2025 grant. So the advantage to this is that there's not a gap in funding. It starts at the end of the prior grant. And there's 12 months to fully transition to the new component. A lot of lead time to work through the new model and figure out what to do with clients and how to classify everything. More than one grant can be combined to create a single transition project. And YHDP projects have to submit a YHDP replacement application. Those are separate. And grants in this competition will expire transition in 2027. So this is really can get out there. If you look at the first grant expiring in 3 of 27, and the last one for Rhode Island will be expiring 12 of 2027. Really getting far into this administration. And they would need to be fully converted by the end of 2028. Next slide.
Yep.
Okay. Grant term for new projects. So you may request 1 year of funding, and you may request in the initial year that the funding be used for a period of up to 18 months, not for expansion. But it's 1 year of funding that can be used up to 18 months.
Okay. Sorry.
That's okay. All right, indirect costs. So just as a reminder, I always like to clear it up for myself too. Those indirect costs are those that they're shared across all the areas of your organization. They can't really readily be identified to any particular activity. So how you approach your indirect costs needs to be consistent across all your awards. You can't say that you have none for one project and you have de minimis for another. It needs to be the same across all federal grants that permit you to add those costs. The indirect cost percentage has to be applied just to the direct cost base. And what is included in that varies. That means that if you have a grant that is half rental payments to clients, you can't include indirect rate on that because that's not really part of what you're doing in your work efforts and stuff. The indirect rate has to be applied to that base of cost that the services that you are providing. If your agency has a negotiated indirect cost rate, that must be used. I think the process to get that negotiated cost rate with the federal government is pretty arduous, so you would know if you have it. And if you've gone through that process, you need to use that rate. And if you don't have a negotiated rate, the de minimis rate now is 15%. So you can apply for up to the 15% rate, again, applied only to those direct costs that are eligible. And HUD, HUD has a whole guidebook about what exactly those costs are per project. If you do intend to claim indirect costs, they have to be indicated in that eSNAPS application. And if you have that negotiated rate, you need to include that documentation or confirmation to the application. Anybody can claim that 15% de minimis rate as long as, again, you've never had negotiated rate settled. And this last slide has the link to the toolkit, really, so you can really see more information on this and what is considered a part of that modified direct rate that you can apply those costs to. Administrative and indirect. Applicants may request up to 10% of total funding for administrative expenses. These are direct expenses, and you must document them according to personnel costs. So these are, people that you can show are cutting checks directly for rent, or they're doing administrative services, supervisory directly over the direct service provision. And indirect costs can be claimed on eligible administrative and other direct costs, so that you can apply that indirect rate to the administrative expenses as well. VAWA costs are eligible for all new program types, and this includes the costs of actually administering those emergency transfers, which is assistance with security deposit, utilities, housing fees, navigation, all the expenses that pile up with those transfers, and also monitoring compliance with confidentiality requirements. So that is training on compliance, reporting on collaborative applicant and HUD, and coming up with a methodology to protect survivor information. Okay, now to the threshold criteria for new projects that Howard mentioned. So we really have to hit all of these criteria to be able to be forwarded as a new project. So you have to use HMIS, or if it's a domestic violence program, it has to be a comparable database. Have to follow coordinated entry policies and procedures. And this new requirement we have that the applicant agrees to use the Continuum of Care Service Participation Agreement. And your accounting systems have to meet HUD standards, federal standards. The applicant also has to certify that they do not operate safe consumption sites. You have to serve target populations for HUD 1, 2, and 4. That's, literally homeless, domestic violence, and then also some amount of prevention. And finally, you have to meet those match requirements where they apply to your programs. This is a look at the scoring criteria. So we do have to score, provide points on whether the service participation requirement is met. And you come up with some plan to meet this 40 hours a week of services. Again, they don't all have to be expensive. They can be, referrals to other community opportunities. And then also you can apply SSO projects to some of their services provided can also meet that requirement. We're looking also at experience with the project type and population, ability to manage federal funds, organizational capacity, collaboration, always also looking at the design, incorporating people with lived experience, and other making sure the supportive services are adequate and costs are reasonable. Okay, there are bonus points, but they are a little bit complicated. So there's healthcare leverage. So you have to show that you either are able to provide access to treatment for all participants who qualify for services, or you have behavioral or healthcare provider that is committed to providing at least 25% of the total funds requested from healthcare resources. And again, as Bill had asked, I think we're going to get more specific. Hopefully, we get more specific information on what what requirements they have for treatment services, what exactly that means. But you can have one of those two options for bonus points, or housing leverage is you're getting housing assistance from some source other than the COC or ESG that supports at least 25% of the units for PSH or TH or the participants in record housing. And you get 10 bonus points for meeting either or both of those requirements. We've provided budget forms for you to fill out. There's a different one for projects claiming indirect versus those that don't have indirect. And the form is set up to automatically compute only those those costs that should be included for indirect. Only enter data into the yellow tinted rows, and the form looks like the one below. So the application process, you need to submit to your COC coordinator, and the deadline is June 12th at 3 p.m. We don't want the application to exceed 10 pages. That's excluding the budgets and the support letters. And next.
Yep. So,
These again is the eligible activities by program type, just by component type. Sorry, just to review this one more time. The PSH and transitional housing are very similar. It can be lease units or structures or rental assistance allowable, tenant sponsor or project. You can have supportive services on that budget, operations, HMIS, VAWA costs, administrative. But if you are doing that reparative housing for a reallocation or DV bonus, you can't do leasing. The rent has to be paid through rentals, tenant-based rental assistance, and you can't have operations costs. And there's one more thing to consider, which I believe you all are aware and are discussing this, is that I think since HUD has just been not focusing on transitional housing at all, it's come up that you can't, now that we're going back to transitional housing, that nonprofits aren't allowed to administer rental assistance. And so the way to get around that is to use leasing or to contract with someone else to make those payments. But if you do use leasing, you have to be reminded that the rent cannot exceed that FMR, which can be an issue to some places that are using rent reasonableness to go above that FMR. Also, although the benefit is that if leasing is used, utilities and furniture costs can be paid on a separate operating line.
I think, yep.
And that is it. There's one more question about more details on how SSO projects can have a strategy for coordinating with housing providers and implementing that service participation requirement. Howard, can you take that one?
Sorry, hold on.
Oh, sorry.
Let me go back to the chat here. I'll be there in a second. So the question is the one about, can the grantee determine which services will count towards the services requirement? Is that what I'm sorry.
More details on the idea of SSO projects coordinated with housing providers to hit that service participation requirement.
Well, okay. I mean, so obviously HUD is emphasizing the use of supportive services only for just enhanced services. Um, the goal is, and the challenge is, what you want to be careful about is you don't want to link an SSO project too closely to an existing permanent or transitional housing project, because then HUD would classify that as being a permanent or a transitional housing project. So an SSO project should offer services to everybody who is eligible to receive COC services. They should be targeted towards a specific service need, and they should be made available to all the participants in the COC who could be eligible for them. So we don't want to, you don't want to submit an application that we're doing expanded supportive services just for the residents of our projects. It should be available for anybody who is going to qualify for that service in the COC. Hopefully that helps some.
I'll jump in on that also. So everything that Howard said is exactly right. But also in terms of your strategy for coordinating with housing providers, we're just looking for you to describe how will you make sure that housing providers do know that your services are available to the people that live in their buildings. We're really just looking for you to describe that. It doesn't have to be every single detail worked out. We're just looking for you to overall describe, how you're going to make sure that people know we have these services that are available to people. It's not just for people that live in your housing project, but if people who live there want to engage in these supportive services, and like Howard said, you can describe exactly like these are the kinds of services we're offering. So if any of your residents want these services, they can engage with us, and this is how they do that. I think we had another question asking to just review the requirements or the opportunities around street outreach applications. You're on mute, Howard.
See that. So again, want to again, street outreach is obviously going to be targeted towards people who are living unsheltered at this point in time. The goal of street outreach is to connect folks to services as much as possible. HUD has saying that there should be coordination with first responders and law enforcement in street outreach projects, which does not mean that you necessarily need to go if they've decided to go in and clear an encampment. You need to go in there and be part of that effort to clear that encampment, but that you will have some liaison with whatever first responders there are, and they are informed of your efforts to try and engage with folks, and you're aware of what efforts they're going to be making towards limiting street camping and other effects. So basically, just show as much as you can that your efforts are being coordinated, and there's some overall goal of those efforts to limit the number of people who are living unsheltered. Emily.
Hi, yes. So we're already from Newport Mental Health. So we already received the RICoC funds for the permanent supportive housing. So this would be, I think, a new project from one of this would be an expansion. We offer street outreach services here as well, but we'd be looking to kind of ramp up as we see a need in the community adjusting. But like my question, I think, is, are there a lot of restrictions from the federal government that I'm missing that I don't know about? I know you kind of alluded to some here. And I also, the application is not live yet, right? Like I just looked on the website and I don't see it. But am I missing something? Am I in the wrong area?
You mean the eSnaps application or our own internal Rhode Island application?
Where our organization would apply internally. Because we wouldn't be applying for the eSnaps, right? That's what y'all apply to.
Well, both. I mean, so the initial application is using, we are going to be producing a formal application form next week, but the
Okay.
guidelines as to what's going to be included in that application form are basically in the RFP that were issued last week. So
Yep, I have
those
that.
are the information that we have. We'll have an application form that will be submitted by email to Sarah as the COC coordinator.
Okay.
And then, as I said, assuming that everything goes right, that application is passes threshold and is scored, then at the end of that process is when you're going to be invited to submit the formal application to HUD through eSnaps. But it's not going to be until we get through this internal process first.
So the application that we will receive next week, that's the 10-page limit?
Yes,
one, or is it,
exactly.
it's, okay, it's the
Yep.
10%.
It'll be that one, but it'll basically say this is what you want to do on pages 1 to 3, and this is
Okay,
what you do on pages 7 to 10.
okay, got it.
Great.
And that comes from, that's gonna, sorry, I just want to clarify. So it's gonna be on the website, or will we get an email communication to know it's live, or how does that roll out?
That application form will be both. It'll be, of course, posted on the website, but we also email it out to everybody who's on the email
Oh,
list as well to
all
make
right,
sure you get it. Right, Sarah?
excellent. Thank you so
Yeah.
much.
Yes, that's exactly right. So Emily, I'll be the one emailing that out, and my team maintains the materials on the website. And just to be clear, the application form that's being provided will be directly based on the scoring criteria and everything that's outlined in that new project's RFP document. We're just pulling it out to try and make it simpler for applicants so that you don't have to reference everything in the new project's RFP to write your application. But there will be no surprises of what's in there when we
Yep.
release it.
Suzanne.
Couldn't get off mute. A question about the SSO projects. So,
Mhm.
if you're an agency that receives one of these and you're helping people find housing, you're providing case management, emergency financial assistance, for those folks coming to you for that, will there be a service requirement?
Well, I don't think so because basically the only way a supported services only project, I mean, the participant has got to participate in services or else they're not a participant. I mean, if you're it's a housing project, you can be housed and then say, case manager, get away from me. I don't want to deal with you. But if it's a supported services only project, I don't know how you can. I mean, you could say they're enrolled, but unless they're engaged with, I think the whole notion of the project is they're receiving services from you. So I don't know that it has a service. I mean, it's all about services. So I think by becoming a participant, they're going to agree to. Now, if it's say it's an your service is employment targeted, then I would think you may have some condition. You've got to attend X number of classes a week or something. I don't know how the program would be structured, but there would be some. But otherwise, if it's case management working towards addressing some of those other issues and stuff like that. I think it would just be the understanding if to be a participant, you've got to engage with your case manager.
Right. That seems to be
Yeah.
logical. And I would imagine that that agency would be coordinating with other,
Yep.
housing providers to let them know that this individual is receiving services from you so that it could count
Yep.
towards their requirement. Does that make sense?
Yep. Yep.
Am I getting
And
that right? Okay.
the application is going to say they would expect to serve 60 people, 70, some estimated number of persons. And then, whoever your staff is obviously going to be maintaining some kind of case notes. And they're going to show how many participants, what participants they are and the interaction they had with those participants in those case notes.
Okay. All right. Great. Thanks.
Okay, I'm not seeing other hands, but but I didn't focus on it. A question came in, or did we address that?
I have a question,
Okay, please.
Howard. If we are transitioning a rapid rehousing program into a transitional housing program, is there any clarification on what that, we have 1 year to make the full transition, right? Is there any clarification on what we can charge for rent? In other words, right now, some of the units do not meet FMR.
You mean they're above?
Yeah, they're rent reasonable.
Uh-huh.
Do you
Yeah.
think we'll be allowed to bill for rent reasonable until we find units, or do you think we'll have to be capped at FMR?
So I think here is what's going to happen. So basically, you've got tenants in the rapid rehousing program who've got rents that are at the reasonable rent level. So that's
Yes.
one of the reasons why we went through that time frame and saying that basically all this transition is going to happen sometime in 2028 is saying that basically you can continue paying on the lease under that rapid rehousing program when you start up the transition thing. Basically, that should give you enough time to get to the end of that lease period. And
Okay.
basically, when that lease period ends, then you're not going to be able to renew that lease with that participant. Certainly not if the rent is, first of all, they might have to transition from rapid to transitional housing. You might have to switch it, but at that time, you're not going to be able to sign that lease above the fair market rent. You're going to have to be limited by fair market rent there. But you should have sufficient time if you're using the transition model to be able to complete whatever lease term your rapid rehousing participants are in before we have to make the transition.
Right. Or find units that do meet the
Yeah,
FMR,
exactly.
right?
Yep.
Okay. Okay, thank you.
You're welcome. Um, okay, now, Bill, you had a question about this dollar. You know, that I wouldn't be put too much weight on. We project there's 250,000 for SSO and these other things for housing projects. Where I think the COC is open to all these project types. We're just taking a look at the potential money that's available and seeing how it could be distributed. But I mean, if you've got a great SSO project that's going to need $350,000, submit that application in for that. Again, our factors are: is it reasonable? How does it fit in with Crest, all the other funding requests that we have? So we've got to make it work for everybody. But don't, those were not intended to be caps. They really intended to be illustrative, and I wouldn't put too much weight on that, especially if we've got a great project that requires more resources submitted, because it could very well be the project we need.
And I would add to that, if you're transitioning an existing grant to an SSO only project, the full dollar amount that you currently have available under that grant is available for your transition project. Those dollars are set aside
That's right. Yeah.
for existing grantees. So like Howard said, the numbers in here are more of an illustration than a hard cap. But those are for brand new projects, not associated with an existing grant that needs to transition.
Thanks, Sarah. That's exactly right. Thank you.
Does anyone else have thoughts or questions, things you want to chat through with us?
HUD is releasing guidance as we go. They just, I think yesterday, maybe early this morning, but I think it was late yesterday, issued, and we'll post this on the website as well. But they issued some guidance on folks who are currently in permanent housing, whether they could be eligible if a permanent housing project is not being renewed, could they be served through transitional housing? And HUD issued some guidance as to how they could continue to be served. People in permanent housing could transition to transitional housing if that is necessary in order for them to avoid becoming homeless. So we'll post that on the website. Those of you who are on Facebook, there's a Facebook page called the Hub for Ending Homelessness. It's a great resource, and that was posted there already. So if you're on, waste your time on social media, check out that Hub for Ending Homelessness, and you'll get some good information there as well.
Thank you all for taking the time to join us today. I want to reiterate something that Howard said. Through this application process that's open right now, we are just looking for you to submit your best effort in an application. We're not expecting that you'll have every single detail worked out. As you all know, HUD is releasing guidance as we go, like Howard said. And so we're using the information that we have at the time to make the best decisions that we can. But with all of this uncertainty, we understand that we're going to get applications, and our scoring committee may need to come back to applicants and ask some clarifying questions, may need to work with you to polish up your application a bit as we move into the eSNAPs portion of the process. And that's all okay. We understand that this will be the process ahead of us. So just put the best application that you can in, give as much detail as you can, but know that we're not expecting you to have every single small detail hammered out by June 12th when you submit your application. So this was our second information session. We've recorded this one. We recorded the one yesterday. And we have an office hours next week on May 28th, also related to this topic. So we will be posting the recordings and the slides. I'll be posting all of the questions that have been asked and answered through these sessions and through other conversations with grantees and applicants. But the planning team, myself and Rosa Felix Pichardo, we are also available to anyone that wants to talk, outside of these information sessions and office hours. My contact information is on the slides. I'm sure that I have popped up in most of your inboxes. So please feel free, reach out to me, give me a call, send me an email. let me know how we can support you. We're happy to set up time to talk through your thoughts, to make recommendations on strategy, to work through things with you, to answer your questions. Basically, however we can support you, we are here. So don't hesitate to let us know how we can do that.